Hi, Dr. Kevin Zorn to talk a little bit more about my Contino. Sometimes my patients ask me, where does my Contino fit in the spectrum of treatment for stress urinary incontinence? I guess digging down to different roots and causes of stress incontinence, whether it's permanent or a temporary issue. Usually the first line therapy is going to be with muscle exercises, kind of like doing push-ups, called the Kegel exercises, named after Dr. Arnold Kegel. Pelvic contractions, thickening the muscle, working with a physiotherapist is one non-surgical way. Then you move to the other spectrum of surgical, in which a artificial sphincter is placed in the perineum around the urethra. That'd be a surgery. Certain companies make these rings that tighten up with water pressure, squeeze that urethra, but it's an invasive surgery. It's another surgery one would have to go through. Certain patients have had radiation, so they may have higher risks of infection or issues with the treatment, and plus the surgical wait time. Well, what is in the middle? We have other external or internal compressive devices. The external being the Cunningham clamp, kind of like a guillotine, soft cushiony foam to squeeze the penis from external. So if kind of one were to pinch his penis and walk around, he wouldn't leak much. So this is an external device that would fit on. Unfortunately, some men are different habituses, have more fat pad, not circumcised, and that can sometimes slip off depending on the body position and the comfort level. Not everyone enjoys having that externally, and the efficacy is not always there. So enter in Contino in that mid-spectrum between physio surgery, small insert placed intraurethral. So with a small bit of lubricant, this would slide right into place between the two markers, lift up, pull out, we're done, we're capped. Kind of like as simple as using a plug in your sink. You plop it in, you can fill it up, so whenever this gentleman coughs and sneezes, nothing will leak out. So immediate dryness, immediate better skin hygiene, odor, no need for any pads or protection. So really a cost-effective, Canadian-made, clinically proven device. Again, fits in that mid-spectrum between a surgery and physiotherapy, and either can be used as a long-term solution or as a short-term until all those physiotherapy, all those Kegel exercises kick in, which certain men after radical prostatectomy may need. So this may be a short-term bridge or a long-term solution, but something that you should be considering if you have moderate to severe urinary incontinence. So give us a call, learn more at mycontino.com.